Good day, everyone. My name is Toyosi Labeodo, and I'm here today to share my experience with you as regard what I personally experienced in one of the healthcare facilities that I went to in Canada some years back. Now, one of the major reasons why I migrated to Canada, one of the reasons why many people want to migrate to Canada is because of the healthcare facility. In Canada, healthcare is free. You don't have to pay to see a doctor. You don't have to pay to do medical tests. You also do not have to pay to do a lot of expensive tests or medical assessment that people pay for in the countries where they live. I remember this experience I had was for childbirths, and it was such a pleasant experience that I feel I need to share that with you guys here. So I came to Canada some years back, and before then, I had childbirth experience at least twice before I came to Canada in the country I used to live permanently in before. And in the course of this discussion or the course of this talk, I'm going to try and compare my experience in Nigeria, to be specific, and the experience I had here in Canada. Now, I'm sure many of you should know, as a man, the experience I had in Canada was my first experience witnessing the birth of my kid. I have 3 kids at the moment, and the first 2, because we gave back to them in Nigeria, I never had that experience. We gave back to them in a public hospital in Nigeria, and as usual, they will not even allow you to move near yourself. They will have so many reasons to tell you, sorry, you cannot. But the experience I had here was so wonderful, and I'm going to start and tell you about it. So we got to, my wife fell into labor, and I took her to the hospital. She had been seeing a O&G doctor before now, and they had an idea of the day she would give birth, and they told her, okay, anytime you feel like you're ready or it's about to come, just come here. So I drove out to the hospital that day. But the funny thing about that particular day, which I cannot forget, there was so much snow that day. In fact, there was a major snowstorm in Edmonton that day. So we drove carefully, took her to the hospital, got to the hospital, and as soon as we got there, it was as if they were already expecting us. I don't know. They took us into a private room. Now, this hospital is a public hospital. It wasn't a private hospital. It was a public hospital. So they took her into a private room, and instantly someone came, they started attending to her. And one of the things I noticed was that they actually placed some things on her body, which was actually measuring the heartbeats of the baby inside her. And all of us in that room could hear the heartbeats. So if anything was going to happen, or if there's going to be anything going on with baby, everybody will know. Even you that you're not a medical person, you were hearing it. It was beating loud and clear. Everybody was seeing it on the screen and all that. So they attached a lot of things to her. They came in, greeted her. Everybody was laughing with her. They were trying to, she was in pain, but they were trying to calm her down, And the way they were doing it, it was so cool. They were very professional about it. And one of the things I remember I told her was, if you cannot bear the pain anymore, tell us. We have what we can give you that would reduce your pain, and you still give birth through normal delivery. Like they kept telling her, If you think the pain is becoming unbearable, just let us know. Now, I remember very well when we had our second child in Nigeria. I was in the hospital with her. One of the young doctors that was attending to her that day actually spoke very rudely to my wife. I got annoyed myself. That was in Nigeria. And what happened? He was trying to listen to the heartbeat of the baby, and my wife was in labor. She was in pain. He put what they used to listen to the heartbeat on her tummy. And in the course, because of the pain she was having, she was moving and all that. And the guy rudely spoke to her and said, "Will you stay?" If I felt embarrassed myself to that. Come, this person is in labor. Why do you have to talk to her like that? And I tell you, my wife had to tell him that, "Excuse me, if you're not ready to attend to me, please leave me alone. I'm in pain, and you're talking to me like this." I'm trying to compare the experience we had in Nigeria, in the Nigerian hospital, which is a public hospital, to the experience we had here in Canada. The nurses were there, the doctors came, they were very polite, they were very professional. They told her, if you feel the pain is too much or unbearable, let us know, we would give you something. Now, one other thing that I remember very well was that a lady came in and she introduced herself as a student nurse. And one thing I noticed about her, which she did, which was very not surprising, we're in an organized setting. She introduced herself as a student nurse and requested for consent. In fact, the senior nurse who was there introduced her to us and asked us, "Are we willing that she examines my wife?" And we said yes. And she told us she's a student. But she did not just come in and say, "Lie down, let me check you. This is this." She introduced herself that she's a student and this is this. Are you interested? If you said no, there's nothing they will do. They will say they will leave you. But we said yes, that's fine, and everything was going on and all that. So anyway, I was in the room with her. That's just the story I want to talk to you about. How I was in the room with her. I told you that before this one, we had 2 kids in Nigeria, and I never had that experience. This hospital too, where we gave birth to our third child, is a public hospital, not a private hospital. Yeah, if it's a private hospital, I'm sure that in Nigeria things might be different. I don't know, but here it's also a public hospital. They allowed me to stay in there with her. Yeah, they believed that I could give her all the support and all that. And in actuality, this was the first childbirth experience that I'm having myself. The third one was the first I'm having. She had 2 before now by herself, but this was the first one that I was personally there myself. So it's a norm. It's not seen as anything. They expect your spouse to be there with you during that experience and give you all the support that he or she can give to you, which I tried to give to her. So I was up with her throughout. So the student nurse did his examination. The nurse also did ours. The doctor came in. Doctor was coming in and going out. There were 2 other doctors with her because they had other people that they were attending to. But she kept coming, examining her and telling her, "Okay, well, don't worry, you are not yet ready. This is that," and she would go back again and said, "Oh, well, the point was everything was just so calm. It was so interesting. They allowed me to be there. They were doing their work professionally. The senior doctor was available. There were other 2 doctors with her who were supporting her, and they were always available. And there was a nurse with us throughout the process. Just like I said, this is a public hospital, not a private hospital. So at the end of the day, my wife gave birth to a bouncing baby boy, and I watched it live. I was there myself live, and before she gave birth, they gave her when the pain was becoming unbearable, they gave her an injection. The pain was fine, got better. She was able to push, and within a short period, her son was out. As soon as he was out, they put a tag on his hand. And one thing that the doctor said I should do, and my wife should do, they said, I don't know why they said that, but well, they said they wanted us to do skin to skin with the child. So you are supposed to place the child right on your body. My wife did that. I also did that. They said they believe that that F bonding and all that, and I carried him. Despite the fact that it just came out. They did not say no, no, no. We have to clean him for us. We have to do all this. No, 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 no. If you're not okay with it, fine. But they allowed us to. So I carried my baby right after he was given back to, and I put him right on my chest. My wife also did the same thing. They actually placed. She was lying down, so they placed him on her, and she held him, and she was happy. I also did the same thing. I was sitting down. I later got up, carried him, and held him to my body, and for like 2 minutes or thereabout, and handed the baby over back to them for them to clean and do all the things that they needed to do. Now the other nurse came, supported my wife, helped her to drain a lot of things that they had to drain and all the other things that they had to do. Now, just like I told you, I said we had a private room to ourselves. It was a public hospital. We did not have to pay for anything. In fact, they brought pampers. We brought those things. We brought those things ourselves. But the hospital gave us those. They brought their own and used it for the baby. They didn't even ask us that. Where's your own? Whatever. All this. They had a lot of things that that were readily available and all that, and So after she gave birth, I had to leave. I went home to see my other two kids. They were home. Then I came back later with one or two other things for her. But the point I'm trying to make is the experience was seamless. We had a private room to ourselves. The doctors were available. They were on ground. It was at night. It was at night actually. It wasn't during the day. It was at night. It was she gave birth early morning, very early in the morning, and the doctors were there. The senior doctors were there, not the junior doctors alone. No, the senior doctors were there. Other team members were there. The nurses were there. The student nurses were there. Everybody was on ground to ensure that there was no complication, and if there would be, they were ready to pick it up from there. But thank God there was nothing like that. But I didn't have to know anybody. I did not have to. All the tests they had to do were done in that same room. They just brought a machine, took my wife's blood sample, even the baby. All the things they wanted to do, they did them right in the room. Now I want to compare this with the experience I've had in other hospitals in Nigeria. Let me be just specific about that. They will give you the family member the forms. You go somewhere to go and pay for the test. When you go to pay somewhere, you go and collect bottles somewhere else, far away from where you are paying. After you have collected bottles from there, you bring it back to the room or the ward, drop them down on the table or give the nurse. You have to wait. Maybe the doctor will come later on to come and take the samples, and after taking sample, possibly wait again for someone to pick it down. It's a whole lot of processes. In fact, before that time too, you also go and collect NHIS or health insurance or something. Or if you are not using the health insurance, you have to go and pay. You have to go and go to one pharmacy outside the hospital, go and buy some materials there. And a lot of stress for the family member who is with the patient, because this person is the patient at that point. But the experience I had in Canada, there was no stress, no stress at all. I was just right inside that room. I did not do anything. I didn't go anywhere. I sat there from beginning to the end. I did not go anywhere. There was even a toilet inside the room, so I didn't have to go anywhere. All the tests they had to do were done there. All the materials that they needed to bring were brought for us. We did not have to go and buy anything. We did not buy anything. We didn't bring anything. You don't have to go and buy syringe, needle, one medicine, or no. Everything was provided for us free of charge. So you can actually compare and contrast. The experience I mentioned now, is that the same experience that you also have where you are? You can compare and contrast. Now, one of the things that I remember very well was I think my wife was finally discharged the next day. Yeah, she had normal delivery and we were discharged the next day. Yeah, the next day she went up. She actually came home the next day. And I can tell you one funny thing that happened. I told you I went home to see my other kids, came back, and when I got back later in the day, they discharged her. And the nurse asked us, where's the car seat for the baby? I said cassettes. We actually had one we bought because we were ready for the birth of our new son. We were ready for it, but I forgot it at home. Actually, if I already happened was it was in the car that I took. But when I got home, I picked my wife's car. I drove her car to the hospital, and I just forgot to remove the cassette from the car I took to the hospital the night before, and so I said, we don't have it here. That don't worry, I will carry the baby while my wife would. The nurse said, no, they will not hand over the baby to us without seeing the cassette. That's one of the things they are supposed to do, is that they must ensure that the baby is inside the cassette, and they would be the one to ensure that it's well strapped in it. Now, without the cassette, they will not allow the baby to live. I tried to talk to them that, it should be just, we'll just go down gently, be careful. They said, no, they will not. When I saw they won't listen, I rushed back home, went to get the cassettes, brought it upstairs to them. Yeah, they placed the baby inside it, strapped him, adjusted the straps and everything, and handed him over to us, and off we left the hospital, and we came later on for follow-up and all that, and it was a lovely experience. It was a beautiful experience. That was my first time experiencing that, and it was an experience that you would like to experience again, if not for so many other factors. That experience was just too sweet and interesting that even not careful, you want to be giving birth to babies every year in Canada. I can tell you that. That's my own experience. But you have to look at other factors. It's not just about the experience giving birth. You also have to take care of your child and all that. So when you look at all those other factors, you want to question yourself. But the experience at the hospital was so similar. In fact, by the time we were done, they had pasted his name on the wall. There were so many babies that they had that night. His name was there. They pasted his name on it, and when we were going out, we saw his name on the board in the hospital, and so many other things. It was just fun. Everybody was happy. They were happy doing the job, and they were very professional about it. They were not rude. Even the family member, me, that was there with my wife, I was not stressed. It was a lovely experience. So, do you where you live, the country where you currently live, in a public hospital, are you able to experience this kind of experience I mentioned in a public hospital? Do they even allow you to come into the labor ward where your wife is giving birth? Even if you pay for a private room, are you allowed to come into the place? The senior doctors who are supposed to attend to your wife, are they the ones that are always there at night, in the midnight? My wife gave birth around 2 a.m., and all the doctors that were supposed to be there, they were on duty. Public hospital, they were on duty. They attended to her. I did not have to call anybody. I did not have to call my friend up. This is this. Do you know anybody in this hospital? Do you know anybody in this unit? No, everything was just there. All the tests that they did for her were done in the same room. She did not leave that room at all. Do you have that same experience where you are? Yeah, I'm sure many of you have had childbirth experience. So just compare and see if what I'm saying is the same thing that you have where you are. So these are some of the things you benefit when you come here to Canada. Healthcare is free, childbirth is free. In fact, let me tell you something. I remember that, I will mention it, I gave birth to my child at University College Hospital, where I used to work at that time. Despite working there, I still had to pay for a lot of things. Despite working there, I still went through stress. Despite working there, I still had to travel. I still had to go to a pharmacy outside the hospital to go and buy one or two things, go and bring this, go and bring that. I was a staff. It was not seamless for me. That's why being a staff. In fact, just like I said, my second child, I had to talk to this junior doctor. It was an house officer. He was speaking so rudely to her. Someone was in pain, and we were just talking anyhow to her. Please stay somewhere. She's in pain. You did not give her anything to reduce her pain. It's a normal process. We know labor is painful, and you are still shouting on her. while she's trying to give birth. She's in pain. It was not understanding. But the contrast was the case here. Everybody was supportive. The doctor kept saying it. If you cannot bear it anymore, just tell us. We'll give you something and you'll be fine. I had to tell her, take it. Take it now. Why you don't have to go through pain? That's what they are saying. And you still have a normal delivery. Yeah, you still have a normal delivery. So the other one, I was stressed. I had to go here, buy this, buy that. Oh, it was a whole lot of stress. But here, it was seamless. It was stress-free. And then in my own view, you want to have another child the next year. You would, because it was just so interesting, so beautiful, and very enjoyable moments. So these are some of the things that you get when you migrate to Canada. When you come here as a PR, you get access to quality health care. You get access to free childbirth care services. You won't have to pay a dime to give birth in Canada. And I remember very well that even before she gave birth, she was always going for follow-up. They kept calling her, ensuring that she's fine. If you have any challenge, they did a lot of tests. In fact, that was the first time my wife would do. She did ultrasound, and they checked all her organs, all kidney, liver. She had never. She's over 40, but she had never had that kind of experience before. In Nigeria, she never had. You are going for childbirth, and as a some of the pre-examinations they did was to check that all the organs were functioning well. They did this before she gave birth, as one of the when she went for prenatal tests and all that. Those are some of the things they did free of charge. We did not pay for it. In fact, I remember very well that when I went to register her, I put my number there as the number they should call. I had to call them later that please stop calling. Change it to our number. Why? Because every time, if you have an appointment today, they will call you like 3, 4, 5 times before the appointment to remind you that, oh, this is this, you have an appointment this day, don't forget, I hope you remember, this time is, they'll call you a day to your appointment, they'll call you a week to your appointment, they'll call you 2 weeks to your appointment, they'll call you 3 weeks. I was like, your call is too much. I had to call out that, please, update your number with them, let them be calling you, you are the one to have appointment. Yeah, even though I will take you down, you are the one to have appointment, please, update your number with them. Let them be calling you, not me. That is follow-up. This is for a free service. I did not pay anything. She did not pay anything. Free service. Do you get that where you are? Do your doctors call you? Public hospitals, not private hospital, please. If it's private, I understand that's possible. This is public hospital. Do your doctors call you to remind you that you have an appointment? Yeah, don't forget to come today. You are coming tomorrow. Do they call you? And you are not going to pay for it also? So these are some of the things that we get here, and I just wanted to give you an idea of my own personal experience using the healthcare services in Canada. So see you guys